From the San Francisco Public Press, you're listening to Civic. President Trump calls it one big, beautiful bill, but for millions of low-income families, immigrants, seniors, and people with disabilities, it's a crisis.
There's no scenario that this bill doesn't have a deadly impact.
The latest federal budget includes more than $1 trillion in cuts to Medicaid over the next decade. This episode explores what these cuts could mean for over 250,000 Medi-Cal recipients in San Francisco.
I'm angry. I'm not in a reasoning state of mind. I just want to go, Ugh!
And the tens of thousands of workers who care for them.
How could they? We're supposed to be helping one another.
I'm Sylvie Sturm. This is Civic. America is known around the world as the land of the free. We celebrate it on holidays, invoke it in politics, and hold it up as proof of our exceptionalism. We often think of freedom as the ability to choose how we shape our life. Freedom also rests on security. That's why America spends trillions protecting us against criminals and terrorists. But we've normalized a constant threat to personal security. That serious illness or injury could strip away our savings, our home, our future. And that threat curtails our freedom of choice. Do I start a business, pursue higher education, have children, care for an aging parent? Every life decision is shadowed by the same question. What about healthcare? In all other developed countries, people have the security of guaranteed healthcare. And with that comes the freedom to move through life, to change jobs, start over, grow old, or get sick without risking everything. When every choice is haunted by a threat to our security, can we truly call ourselves free? President Trump's recent federal bill proposes more than $1 trillion in Medicaid cuts over the next decade, threatening to strip away health care coverage for 10 million people by 2034, according to the Congressional Budget Office. It's important not to confuse Medicaid with Medicare. Medicaid is federal insurance for seniors and some people with disabilities. Medicaid is based on income and need. Nationwide, 1 in 5 Americans rely on Medicaid for health care coverage, including 40% of all U.S. children and over half of people in long-term care. That's 78 million people. Before the bill was unveiled, Trump repeatedly assured Americans that Medicaid would remain untouched. Here's one example from a statement he made on Capitol Hill.
Here's what I want on Medicaid. We're not touching anything. All I want is one thing. 3 words. We don't want any waste, fraud, or abuse. Very simple.
But the new federal budget tells a different story. The House's own budget resolution instructed congressional committees to find the savings, including through Medicaid, to help offset roughly $4.5 trillion for an extension of the 2017 Tax Cuts and Jobs Act, tax breaks that overwhelmingly benefit corporations and the wealthy. U.S. Representative Alexandria Ocasio-Cortez from New York said the cuts seemed like an attack on people in need during floor remarks on July 2nd.
Waste is being used as a very large word here because what's being suggested is that long-term care is wasteful in America, that children's health insurance is wasteful in America, that poor people seeing the doctor is a waste, that all of these people are disposable, that the elderly are disposable.
Drilling down on the numbers reveals just how high the stakes are for California. The state receives more than $81 billion in Medi-Cal funding per year. Medi-Cal is what California calls its Medicaid program. $2.1 billion of that funding goes to San Francisco, underpinning the city's safety net services and public health programs while supporting jobs and fueling a major segment of the local economy. More than 250,000 people in San Francisco rely on Medi-Cal to stay healthy, safe, and in many cases, alive. That's nearly a third of the city, and it includes 52,000 children and 35,000 seniors and disabled adults. Some rely on it for routine doctor visits, others need it to survive day by day. In June, Tangerine Brigham warned the San Francisco Health Commission about the bill's far-reaching consequences. Brigham is Chief Operating Officer of the San Francisco Health Network, part of the city's Department of Public Health.
It will have a devastating impact. I don't think there's any way to sugarcoat it. I'm not here to try to sugarcoat it. Yes, critical programs will be underfunded. We don't know which ones at this point.
One thing is certain, Brigham said. The bill will make it harder to access and provide health care.
There are only 3 ways to reduce expenditures in a health program. There is the number of people who are eligible, reducing that. There is reducing the range of services that you offer, so you're offering less services, or reductions to funding for the providers. So work requirements is, I think, for some in Congress, they see it as a way of limiting individuals who are eligible.
Brigham's warning highlights why state leaders see the bill as a threat to both California's health programs and its fiscal stability. The federal bill caps state funding options and slashes enhanced payments that help cover care for high-needs populations. That puts tens of billions of Medi-Cal funding at risk. It hits especially hard in long-term in-home care, where even small funding losses can make services unsustainable. The state's in-home support services program helps low-income people with disabilities, chronic illnesses, or age-related conditions live independently. People like Carol Crooks, a 77-year-old retired teacher living in Oakland. Her income is about $1,000 a month from Social Security, and she lives in Section 8 housing. When she received a breast cancer diagnosis in 2012, she was able to secure temporary Medi-Cal funded in-home support. Then back surgery in 2016 left her with physical pain and mobility challenges. Since then, Crooks has relied on in-home care to help her with the daily chores she needs to maintain an independent, healthy, and fulfilling life.
Here I have neighbors that are real supportive too, besides the caregiver. It makes a difference for me to be able to live independently. I just wouldn't have as many choices. I'm co-convener for the Berkeley Gray Panthers, and I wouldn't be able to do that. I'm active in a number of community organizations, and I'd be pretty limited.
Crooks said she has no close relatives, and her care provider, Florence, has come to feel like family.
It's almost 3 years. She's my adopted granddaughter, Nan. She's been really good to me. She cooks for me. She helps me with showers and cleaning, and she takes me on errands to my doctor appointments.
She shudders at the thought that Medicaid cuts could force her into a nursing home.
If I were living in a nursing home, it wouldn't have much going for me. Just the idea of it just makes me ill. I just had a taste of being in the nursing home. I was in there for 2 weeks and 3 days last year for my knee surgery. And this year I was in there 1 week. And nursing homes are not known for good service, or they're not. I went to the same nursing home for my cracked pelvis in 2020. They have really good physical therapy and occupational therapy. But if you need somebody's attention, it can take you an hour to get somebody to come take care of you. It's not pleasant. And then there's just a thing of being stuck in a home and get stuck with whoever roommate you get. It's got a warehousing aspect to it. And they're going to be even worse than ever because they're going to be more stretched and more overworked. I feel numb. It's frustrating. It's so seeing what's going on at the national level. It's ugly. They're not protecting the common person anymore.
Crooks said she's doing what she can to make a stand.
I've been answering a lot of emails where they ask for a signature or letters. And I've talked to people that are open to it. A lot of people just don't want to think about it. But they're going to pay for that. Thousands of people are expected to die without Medi-Cal. And I don't see how they can support that. But I still having the problem of not being able to come up with the right words that I want. I'm angry. I'm not in a reasoning state of mind. And if people ask me for facts and positions, I want to spit. It's not good. But that's where I'm at right now. I just want to go. Ugh!
The threat isn't just in funding cuts, it's also in the fine print. New policies introduced by Trump's federal bill could strip away coverage through paperwork alone. Starting in 2027, Medicaid recipients will have to submit proof that they're eligible for coverage twice as often as they do now, every 6 months instead of annually. It's a new rule that critics are calling death by paperwork. That's got Carol Crooks unnerved.
As soon as I get paperwork wanting me to update, I'm going to turn it in right away because they're going to be swamped with paperwork. And I don't want to get disqualified because they were swamped.
The bureaucratic hurdles will cause millions of people to lose coverage, according to Congressional Budget Office estimates. Joanne Liu, president of the San Francisco Community Clinic Consortium, described the anticipated local disruption.
The demographics of our patient population, it'll be that much more challenging for them to keep up with the paperwork. For example, our community health center patients are over 50% limited English proficiency. So many of them probably have somebody either in their family or at the clinic or someone else helping them out, gathering paperwork and with the forms. So yeah, we do anticipate that'll make it that much more challenging, and people will fall off. I mean, we have concerns from the local level, right? Like the city and county of San Francisco has to process twice as much paperwork, basically, in that new world as they did before. So we're kind of have concerns about how do we make sure that's not an additional burden for the patients and the providers and anybody. You know, a lot of times our clinics do help them navigate, paperwork and the documents and things that are needed to do that. So that's one example where we're concerned that there will be kind of a double the amount of hoops to jump through to get the same benefit.
San Francisco has about 29,000 in-home care recipients who rely on more than 28,000 care providers. Since most long-term care is not covered by private insurance or Medicare, a vast number of people rely on Medi-Cal to stay in their homes with dignity. When Medicaid is cut, in-home support is often the first to feel it, especially because it's considered an optional service. So it falls on states to make up the difference. But California was already facing a $12 billion deficit when the federal Medicaid cuts were announced. During the last budget negotiations, Governor Gavin Newsom proposed capping in-home service provider hours, cutting those services for undocumented adults, and reinstating restrictive asset limits. Lawmakers rejected Newsom's proposals, but that's not a guarantee for the future. The state could be forced to make some tough choices in upcoming budgets, like paying caregivers less or pushing more people into institutions. The nonprofit Disability Rights California works to protect and expand the rights of people with disabilities. The group's representatives explained what was at stake during a webinar in July. Sabrina Epstein is a policy analyst at the organization.
Because we know that this year, California had, in the big scheme of things, a pretty small deficit. And even with that small amount of money, they still tried to cut from the services that we need. So if that deficit were to get even bigger, if California were to be missing more money, then it's pretty likely that they would try to cut our services even more. So we need to tell Congress that that's not okay.
Vivian Juan is a policy attorney for Disability Rights California.
Federal Medicaid funding makes up anywhere from a third to about a half of the total budget for California's health and human services programs, depending on which program you're talking about. So if the amount of that funding decreases or is changed significantly, That could force California and other states to have to revisit or reconsider what they can provide. In other words, it may force the governor to propose further budget cuts, unfortunately. That is a possibility. We don't know for sure. A lot depends on what happens at the federal level with Medicaid funding. But I did want to note for everyone that although the news that we got out of the budget deal this week was more or less good news for the most part, it's not over yet. If it turns out that the state needs to make further adjustments to the budget because of what might happen with federal funding in August or September, that's when the governor would need to propose further budget cuts again, and then a smaller version of this process would start over again. The legislature would take a look at the governor's proposed cuts, and it would be up to the legislature to push back on them, suggest alternatives, or propose possible compromises or a middle ground. It's unusual. That usually does not take place in most years, but as we all know, this is not a regular year. So stay tuned.
It's not just clients who lose out, care workers do too. Home care workers told me they rarely see their work reflected in headlines or political speeches, even though they're holding together a system that millions depend on. Boxanet King is a seasoned in-home caregiver and union leader in Region 5 of SEIU Local 2015. For him, the federal cuts aren't just a policy dispute, it's a familiar, exhausting cycle.
This is not the first time our government has destroyed them. And now it's deja vu. You know, when the system is working, they come back in, they want to tear it up. How could they? You know, based on everything we done been through, raised how, we're supposed to be helping one another. All our work over 40-something years is just tear it down. Why is that? You know, they keep tearing it down.
Cuts to Medi-Cal threaten to make jobs less secure, worsen the severe shortage of care workers, and drive already meager wages even lower. Arnulfo de la Cruz is president of the SEIU Local 15, the largest union in California, representing over 500,000 long-term care workers.
This is a workforce that, for the most part, lives in poverty. The wages and the benefits are not what you think about for traditional union members or a union contract, right? The vast majority of caregivers, San Francisco's actually an exception. We're very proud of that, but the vast majority of home care providers in this case live in poverty, right? They make a little bit above minimum wage. They don't have a retirement plan. So the issue, and this is what I spoke about being the crisis of care, last year in San Francisco County alone, there were about 3.2 million authorized hours that went unused. And what that means is if I'm a consumer and I have been authorized hours because I have a condition or I need a home care worker to visit weekly or daily, depending on my acuity, whether I have a disability or I'm someone who's aging, I'm trying to find a home care provider. I've been authorized hours by the county, and I'm unable to find a provider for a lot of the conditions that we just talked about. You're talking about the risk physically. I think there's an enormous mental health risk as well that as someone who's aging, we know that mental health and physical health are directly related, right? But I think the beauty of IHSS is that you're able to receive care at home, right? And many of the caregivers have a very personal relationship with the people they provide care for, almost like a family member. In some cases, I remember a very well-known caregiver in San Francisco who's been recognized by the board for many years, Daisy MacArthur. She cared for a gentleman, I want to say more than 30 years until he passed I thought he passed at 100 or 101. They were recognized by the leadership of San Francisco and the caregiving community. Miss Daisy, for me, is a perfect example of someone who has, had cared for the gentleman nearly a third of his life. And so if you were to rip apart both the emotional relationship, the physical space, their home, and have them go into a skilled care facility where there's already enormous challenges just to meet the existing need, never mind that there's just not the space, I think it's a recipe for disaster.
And the worst part is that what seems like a budget-saving measure in the short term turns out to be an expensive mistake. Supporting a senior to live independently with the help of a caregiver costs a fraction of what a nursing home stay does. If home-based services are cut, many older adults are forced into far more expensive institutional settings, if they can find one at all. The same goes for people with disabilities. Cut in-home support, and you raise the risk of emergency room visits, hospital stays, or even homelessness.
There's not enough skilled care beds in San Francisco County to be able to house the roughly, what did I say? It was 29,000 authorized recipients for home care in San Francisco County alone. The nurse to patient ratio, or the certified nursing assistant to patient ratio, is already far exceeding what we would describe as being quality care, right? The number of patients that a CNA can take care of and do it well. In some cases, you have CNAs caring for more than 13 patients on one shift. If the needs of consumers on the home care side would have to switch to nursing homes, that would spiral the nurse to patient ratio even more and making it extremely unsustainable. Never the mind that skilled care facilities in San Francisco just don't have enough homes. It's going to lead to seniors and people with disabilities needs not being met. It's going to lead to a skyrocketing number of emergency room visits and people having to look for more skilled care. And ultimately, I think what it's going to lead to is to our communities and Californians and San Franciscans that our health indicators are going to be sicker. There's no scenario where we imagine that this bill doesn't have a deadly, deadly impact on the way that we deliver care in California.
It's not just healthcare costs that go up. Family members who step in to fill the care gap often have to quit their jobs, reducing household income and productivity in the wider economy. Communities suffer from lost wages, increased poverty, and strain on safety net programs. Emergency room visits are also expected to increase once additional copays kick in. Starting in 2028, adults covered under the Affordable Care Act's expansion, those earning just above the poverty line, will face a $35 copay for each medical visit. And providers can legally deny care to those unable to pay. Children, seniors, people with disabilities, and full-scope Medi-Cal recipients won't face the new fee. Supporters say the new copay is about encouraging personal responsibility, but critics say it will force thousands of people who live on the financial edge to choose between seeing a doctor and paying for food, rent, or utilities. A new report from Georgetown University warns that even small increases in cost sharing can keep low-income people from getting the care they need. Georgetown professor Edwin Park explained for Report on the California News Service.
There's a huge body of research showing that cost-sharing increases, even modest ones, reduce utilization among low-income people. That's why this produces savings of $7.4 billion over 10 years.
Cost sharing is just one of the hurdles in the new bill. Another is even more controversial: work requirements. Under the bill, adults between the ages of 19 and 64 would have to log at least 80 hours of work each month to keep their Medicaid coverage, unless they were to qualify for an exemption. The measure is rooted in claims that millions of recipients are able-bodied people taking advantage of the system. House Speaker Mike Johnson zeroed in particularly on low-income adults while talking to Caitlin Collins on CNN.
You don't want able-bodied workers on a program that is intended, for example, for single mothers with two small children who's just trying to make it. That's what Medicaid is for, not for 29-year-old males sitting on their couches playing video games. We're going to find those guys and we're going to send them back to work.
In San Francisco, 87,000 Medi-Cal recipients are working adults. Tangerine Brigham of the San Francisco Department of Public Health explained that research consistently shows that most Medicaid enrollees who can work are already employed or they face legitimate barriers to employment.
We know in California, this was done by Kaiser Family Foundation, 63% of the people already work. So we're not talking about a population for which people believe are undeserving, lazy, or whatever term you might refer to someone who is on Medicaid. We know that the remaining individuals are people who are ineligible. They either are in school or they're taking care of children, or they're exempt because they're disabled.
Critics also say that work requirements cost more than they're worth. Robert Reich, former U.S. Labor Secretary and co-founder of Inequality Media, recently released a video breaking down what happened in one state that adopted Medicaid work requirements.
When Arkansas enacted work requirements, there was no significant change in employment rates because, again, Medicaid recipients already have high rates of employment to begin with. What do work requirements actually do? They kick eligible people off their health coverage due to burdensome and confusing reporting requirements. In Arkansas, more than 18,000 people lost coverage, primarily because of the hoops they had to jump through. If Republicans really wanted to put people to work, they would make it easier to access Medicaid, not harder. After Ohio expanded Medicaid, enrollees had an easier time finding and holding down a job. Healthcare access means people can manage chronic conditions, afford medications, or receive mental health treatment, all of which helps people keep their jobs.
Delaying or foregoing care because of barriers to access can result in more serious health conditions and increased emergency department visits, and ultimately higher long-term health care costs. A study published in the American Journal of Managed Care in 2021 found that low-income individuals who avoided or delayed medical care were significantly more likely to visit the emergency department. In San Francisco, nearly 7,000 hospital stays could have been prevented with better outpatient or primary care in 2022, according to state data. That adds up to more than $100 million each year, based on California's average cost of hospital stays. While we don't have exact breakdowns, Medi-Cal patients typically face higher hospitalization rates than privately insured residents. That suggests Medicaid, and by extension the state and federal governments, likely shoulder a disproportionate share of these avoidable costs. Those preventable hospital stays are a reminder of how fragile access to care can be and how quickly it can crumble when funding is cut. Dr. Monica Gandhi sees that fragility up close every day at Zuckerberg San Francisco General Hospital's Ward 86, the city's pioneering outpatient HIV clinic founded in 1983. Ward 86 integrates medical care with mental health, social services, and outreach for low-income patients.
Our patients are highly dependent on Medicaid and Medicare. I'm extremely concerned about Ward 86's ability to care for our patients adequately with a reduction in Medicaid funding. So I am these days pretty much in a state of anxiety for my patients, in a state of watching the news every minute, hoping that the country rights itself in terms of understanding that our disabled and our low income and our older individuals in this country need health insurance.
The San Francisco Community Clinic Consortium has also been sounding the alarm since the federal bill's proposed Medicaid changes first emerged. The consortium is a partnership of 12 health centers with 29 sites across the city, and last year served about 110,000 patients. For over 40 years, the organization has advanced policy, secured funding, and fostered collaboration around community care. The consortium has built support through online advocacy and public rallies, drawing high-profile allies, including Speaker Emerita Nancy Pelosi, California Senator Scott Wiener, and Mayor Daniel Lurie. Lurie's approach is in clear contrast with other, more vocal California leaders. He has consciously avoided personally denouncing or even naming Trump or his administration, even when responding to Trump-linked policies or controversies. During a rally led by the Community Clinic Consortium on the steps of San Francisco City Hall in August, Lurie framed the city's healthcare challenges as a matter to be handled locally, sidestepping the role of federal support.
San Francisco has a behavioral health and homelessness crisis, and we need a comprehensive system that will meet the wide range of health needs of San Franciscans. Every single day, our workers and care professionals provide that help to the people who need it most. Today, we have a chance to recognize the incredible work and sacrifices these professionals have made. As I've said from the beginning, I am clear-eyed about the challenges on our street, and it's going to take time. That's why my administration has moved with urgency to rapidly help those suffering on our streets to get the support they need and move them into shelter and treatment.
Lurie left the rally before Weiner could deliver his characteristically sharp denunciations of the Trump administration.
They are working overtime to try to destroy healthcare access for the people they hate, immigrants, trans people, but for everyone. And that means that in San Francisco, we need to do what we have always done, which is to go in the other direction and to work overtime to protect and enhance healthcare access for all members of our community. And that will only happen if our community clinics are strong. No matter what these fascists do, we're going to roll like San Francisco, and we're going to support everyone. Thank you.
Pelosi also delivered a withering takedown of the bill's backers during a July virtual briefing hosted by the consortium.
This is a horrible thing that they've done to our country. And in your fight against it, thank you for that, for every individual person who would benefit, but also the fight for the culture and the character of what America is. This isn't who we are. America is great because America is good, they say. Not with this bill. Stupid means spirited, sinful. They go to church on Sunday and pray, and then they prey on people the rest of the week by taking away their food, by taking away their health care. It's awful that we're ready to purge ourselves of this sinful, filthy, dirty, rotten, hateful, lousy, ugly legislation.
The fight is made harder by the bill's design. Many of the changes to Medicaid are delayed until after the midterms and spread over a decade. That could blunt outrage and give lawmakers political cover to support deep cuts. But in San Francisco, advocates, care providers, and public health officials say the impact is inevitable. The ripple effects will be felt by patients, caregivers, and across the safety net itself. The only question now is, how will the system absorb the blow? I'm Sylvie Sturm. Thanks for listening. Civic comes to you from KSFP LP 102.5 FM in San Francisco, a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find all our reporting at sfpublicpress.org. Special thanks to our underwriting sponsor this week, University of San Francisco MFA in Writing Program. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes Executive Director Lila LaHood and KSFP Program Director Mel Baker. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. Support our work by going to sfpublicpress.org/donate. Thanks for listening.